I chose OBGYN because I like taking care of patients throughout their walk of life, from things like preconception counseling, infertility, birth control, through obstetrics, the labor and delivery process, delivery, kind of afterwards, and their gynecology issues, and then finally into menopause. It kind of allows me to have continuity for a patient throughout their life. Things I do on a daily basis, obviously, besides annual exams, obstetrics, routine OB appointments, pap smears, colposcopies. Surgeries that we do specifically oftentimes we try to be as minimally invasive as possible. So if somebody does require surgery, we try to get them in and out of the hospital as quick as possible, whether it's a vaginal approach or laparoscopically. It's kind of the things we try to do. I think that our practice and my goal in general is to make the patient feel as comfortable as possible. I don't want the patient ever to feel like they've been rushed, because I know that sometimes patients feel rushed and they don't feel like they're heard. My goal is always to make sure that they have both those things, and then again to make sure that they feel like they've had a good decision in their care, in terms of me not telling them what needs to be done, but they've kind of reached the decision themselves based on all the information I've given them. Riverside's continuum of care is very nice because it really has almost everything that any patient would need kind of within the healthcare system. That way their healthcare can all be kind of continuous across all areas. So if they see a general surgeon, if they see us an OBGYN, if they see endocrinology, there's a number of areas that kind of are all encompassing. So it makes the continuity easier in terms of if I see a patient, I can see their records easier. They kind of have all the specialties, they're kind of a big center obviously on the peninsula. So it's kind of nice that they kind of have everything incorporated into one. The Riverside Care difference is kind of what medicine should be about, because everything we do for our patients should be the same thing we would expect for our wives, our mothers, our daughters, our family members. Because at the end of the day, we want our patients to be taken care of as well, but same way with our family.